Thank you, Mr. Speaker, and can I say that it's a pleasure to follow the measured and thoughtful speech that the Honourable Gentleman for Stevenage has just given. Can I also put on record my tribute to the Honourable Lady for Cunnan Valley and the very important work that she is doing at what must be an incredibly difficult time for her about putting the importance of care and compassion back at the heart of our NHS. Mr. Speaker, I'd like to focus my remarks today on the current threats to NHS services in South East London. My right honourable friend, the member for Lewisham Deptford, has already spoken about the threats to Lewisham Hospital and the plans that are currently on the table, and I'm going to treat the House today to my own concerns about this very matter. I think it's completely right that today we are debating national expenditure levels on the NHS, but the harsh reality in Lewisham is that my constituents are being confronted with the fact that their local A&E and local maternity department may have to close in order to deal with financial pressures elsewhere in the NHS. The government can claim it is investing in the health service all it likes, but it doesn't feel that way in Lewisham. Last Friday, along with local doctors and my honourable friends, the members for Lewisham Deptford and Lewisham West and Penge, I presented a petition against the closure of Lewisham's A&E and maternity to 10 Downing Street. As has been said already, in 5 weeks the petition has been signed by over 32,000 people. Not only are the proposed changes at Lewisham Hospital unwanted, they are arguably unsafe and unjustified. Lewisham is a busy hospital. Over 120,000 people visit the A&E each year, and last year over 4,000 babies were born there. Lewisham is a place where average life expectancies for both men and women are below national averages. It is sadly a place where sometimes, admittedly infrequently, a stab victim will walk into the A&E from the streets. It's a place where many teenage girls will give birth to their babies. The A&E and maternity departments at Lewisham Hospital are a matter of life and death for many of my constituents. I am therefore not surprised that over 32,000 people have signed a petition to keep a full A&E and full maternity service there. Nor am I surprised that over 100 local GPs, including the chair of the new clinical commissioning group and the head of every single clinical group at the hospital, have written to the Prime Minister expressing their concern about the proposals. The question now for the Minister here today is, will this government listen? Will the Special Administrator to the South London Healthcare Trust, a man appointed to sort out financial problems in neighbouring hospitals, will he think again about his plans for Lewisham when he is drawing up his final recommendations to the Secretary of State for Health? I don't think anyone can be under any illusion about the degree of local opposition that exists to closing the A&E and maternity department at Lewisham. I recognise that trying to balance the books at the South London Healthcare Trust is a hard job, but asking a hospital which isn't even part of the trust to pay such a heavy price seems patently unfair. The plans for Lewisham are based on inaccurate data and flawed assumptions. The size and nature of the caseload at Lewisham's A&E has been misunderstood. The estimated additional journey times to neighbouring hospitals have been woefully underestimated. Yet, the speed with which it will be possible to reduce the need for hospital care seems to be hopelessly optimistic, based more, in my view, on wishful thinking than hard fact. But these aren't the only problems with the proposals. I also can't see how the current plans make financial sense. In the last week, we have, even though the government disputes this, had independent verification that there has been a real terms reduction in spending on the NHS in the last few years. Surely then it becomes all the more important that every pound spent is spent wisely and spent well. How can it be wise to sell off over half the Lewisham site for £17 million, only to have to reinvest £55 million in reconfiguring the remaining buildings on that site to do different types of work? Why sell off the existing buildings in Lewisham only to shell out money at other hospitals to increase capacity there to enable other parts of the NHS to do the work that Lewisham is already doing very well. The 4,000 babies that are born to Lewisham mothers every year will have to be born somewhere. Where? There is not free capacity in the system at the moment. This will therefore require investment. Where are the people who currently use Lewisham's A&E going to go? We've all seen the reports of more and more ambulances queuing outside hospitals, patients waiting to be taken into A&E but kept in the ambulance because of a lack of space. It's asserted that in Lewisham, if the proposal to close the A&E went ahead, only 1 in 4 people would have to go to other A&Es. The other 77% would still be treated in an urgent care centre which would remain there. This figure is fanciful. The emergency doctors at the hospital say to me, based on their own analysis of patient numbers and the nature of the work that they do, that just 30% of people could still be treated at an urgent care centre. Mr. Speaker, I accept that the NHS can't be preserved in aspic. I understand that it must change to meet the demands and challenges of the 21st century. But these changes must be driven by the health needs of patients and not an accountant's bottom line. That is not what is happening. I will.
I'm very grateful for her giving way. She may be aware that we have had a long fight against the downgrade of my hospital, Chase Farm, which many people think is over, which I do not. That I think what is important is that now, with the new demographic figures and population increases in London, that we continue to press authorities and ministers to take these into account, even in this case at this late stage, because where people go is now even more of a priority than she had said before these figures came out.
The honourable gentleman is completely right. Lewisham's population is growing. It has grown 10% in the last 10 years. All the indicators suggest that London's population will continue to grow. It's a diverse population with many varied health needs, and it's absolutely imperative that people in our capital city can access high-quality services close to home. Mr. Speaker, I will conclude my remarks today by saying this. Before the election, the Prime Minister told us that he would cut the deficit and not the NHS. In 2007, the Prime Minister promised a bare-knuckle fight over the future of services at Lewisham Hospital. How times have changed. He has broken his promises on NHS spending, and he has broken his promises about Lewisham Hospital. If anyone needs any proof that this government cannot be trusted with the NHS, they need look no further.